frustrated, like he doesn't know what else to do.
So I would encourage.
That's why we like her, because she's
I would
researching.
encourage you to go to a comprehensive epilepsy center and a neurologist who really understands epilepsy.
I just heard the word
Epileptologist.
Yeah,
Epileptologist.
yeah, that.
Yeah, it's a long word. It's a lot of consonants in that word. It's a little tricky. It stumbles off of your brain. Yeah. We know that inflammation in the brain is very important, and sometimes
we have, like, I run a group and stuff, like a support group, and then just even with the LGS moms, like Tracy, a lot of us have other parents that we've talked to and stuff that I've come across, a lot of us have autoimmune disease ourselves, and then we're having children, and then they're coming out with these, like Duray and LGS and epilepsy and everything else.
Really.
But I know, like, there hasn't been much research on that.
No, but it's a really interesting idea because we could study that in the laboratory. We could generate different animal models of autoimmune diseases and then study the offspring to look for epilepsy or for like hyperexcitability in the brain, and that would be a really interesting thing to do. The autoimmune epilepsies also can happen, and those are we've only really started to understand in the last 10 years or so, really. People do not, we don't always know why everybody has their seizures or why patients have epilepsy. It's a source of frustration for parents. It's a source of frustration for neurologists that we don't always understand why somebody might be having a seizure disorder.
But it's also good, like, for siblings. I mean, I don't know, like, for me, I have 2 other kids, and if they decide to have kids, I mean, my daughter's, like, scared. She's scared. She's like, well, if I have, like, a JJ, and I'm like, you love them, and you do your best you can, But, I mean,
all bets are off.
But, I mean, there's some parents that are not meant for this, and if there was some kind of way to say, hey, like,
what's your risk factor?
What's your risk factor? And, like, my daughter, for example, I can give her a heads up and say, hey, this might be the road you're going to take too,
I don't know the answer to your question about mothers with autoimmune diseases and then children with epilepsy. I think it's a really unique question that really could warrant some study. That would be, and we could do that in the laboratory. That would be maybe an interesting thing to try to do. Only learning a little bit about sort of how the in utero environment contributes to epilepsy. So,
good question. Like what she was touching base on, when you're studying the animals, are you actually studying the animals and their offsprings or their siblings, or is it going in like a format?
Yeah, so we have a very structured way we do it. We do our experiments, and we do it all like with placebos and blindly, and so we don't really know what animal's being treated, but we often will look at siblings of animals, like some mice might have a Dravet mutation and their siblings may not, and then we'll study them together. But a lot of the kinds of epilepsies or seizures we study, we just use kind of normal animals and induce a seizure in those, and so then we just get a bunch of them and get that. So, but it's an interesting question to understand the genetics.